As of today, here in British Columbia, 77.7% of all adults have been immunized against COVID-19, and 76.2% of everyone 12 and older have now received their first vaccine dose. We've delivered 4,511,923 doses of all three COVID-19 vaccines in British Columbia, and of those, 1,192 are second doses. So we've now have over a million people in British Columbia who are fully vaccinated and protected against COVID-19. We have seen some fluctuations, as you know, in supply over the last number of months, which means that some days our mass clinics will have more of one of the mRNA vaccines than the other. Currently, it is Moderna that we have quite a lot of right now and will have in the next few weeks. And we've received word that there may be some decrease in the Pfizer shipments that we're receiving, particularly in the coming weeks. We will do our best to make sure that we have both products available at our clinics, but sometimes that simply isn't possible. And with the millions of doses of vaccines that have been delivered here in Canada and across the world, we are confident that both of these mRNA vaccines are safe and effective and can be used interchangeably. If you are offered the other mRNA vaccine, please be assured that it is safe and it is effective to have either one of these products here in Canada and here in BC. They are both highly effective and very safe. Really, these are the same vaccines. It's the same piece of RNA, the messenger RNA that stimulates your immune system. It's just packaged slightly differently in a slightly different package. And we are confident in the safety and the efficacy of them being used interchangeably. So today, in terms of our cases of COVID-19, we had 56 new cases across British Columbia, bringing the total number of people with COVID-19 in BC to 147,187 people. Of the new cases, 12 are people who live in the Vancouver Coastal Health Authority, 18 are people in the Fraser Health Authority, 3 are people in Vancouver Island, 15 people live in the Interior Health Authority, 7 here in Northern Health, and 1 is a person who generally resides outside of Canada. We currently have 1,150 active cases, 111 people are in hospital, 41 of whom are in critical care or ICU, and 143,579 people have recovered from their acute illness with COVID-19. We have no new deaths to report today, so that leaves a total of 1,743 people we've lost to COVID-19, and our condolences and thoughts are with the families and the communities who have lost their loved ones. The outbreak here at Heritage Manor in Northern Health is now over, and that leaves us with 2 active outbreaks in long-term care and assisted living and 1 in acute care in the province. It is really wonderful to be here in Prince George with my colleagues from the Northern Health region, and this week I'm taking some time to meet with our teams, the teams that have been on the ground, both here in the north, and later in the week I'll have the privilege of going to meet with our teams in Interior Health. And I know how wonderful it is, having been so many months, that we've been working together, pulling together, but mostly remotely. British Columbia, I don't have to say, is a diverse province. And we know that while we have all been in the same COVID storm, the experiences in each region have been very different. In smaller, more rural communities, the risks may be smaller with fewer people coming and going, but we also know that communities across the north are very connected. And as we have seen, if the unwelcome guest of COVID-19 enters a community, it can have a tremendous and sometimes devastating impact. Over the past months, when that happened, we know that great work has been done by Northern Health, by everyone, to respond to try and protect those most at risk, particularly our seniors and elders in communities, in First Nations communities, to support isolation and care of people, in the ICUs and the hospitals who provided that extra care for those who needed it, and of course the essential work of the transfer teams when it was necessary to move people south for care. And we know how hard that was on families and communities when that needed to happen. And it was something that happened across the North over these last few months. And I just want to say my thanks and my gratitude to all of the teams that have been working so hard and the communities who've made it through this really challenging year. But this is also why, for many communities across the North, we have taken a whole of community approach to immunization. We know that it's by protecting all of us, we protect our communities and our families, to ensure that no community and no person is left behind. And to have the summer that we want to maintain those connections that we have across communities in the North, whether we're receiving visitors from elsewhere, other communities, other provinces, or whether we're traveling for work, we're traveling within BC, or eventually whether we are able to travel internationally again. Vaccination is our key to being able to do that safely and to keep our home communities safe too. We were talking in Northern Health today, and I know there's been many different strategies that have been used to help bring vaccine to people and communities across the North. But if you know of a place or an event or a gathering where a pop-up clinic or a mobile clinic would work in your community, let Northern Health know. And you can let them know by sending an email to covid-19@northernhealth.ca. So we can bring vaccine to those who need it and who haven't had a chance yet. And I would encourage all of you to encourage your friends, your family, your neighbors. Have a conversation with your primary care providers. Make sure that you have the information that you need. There's lots of credible information on the BC CDC website about the safety and the efficacy, how well these vaccines are working. And we see that in communities around us. When we're immunized, we protect each other and we protect ourselves, and that's our ticket to travel and to getting into a better summer for all of us. As we move through Step 2 of the BC Restart Plan, we are progressing well. We continue to see a sustained drop in hospitalizations, in new cases in clusters and communities across the province, and now over 1 million people are fully immunized. This gives us a strong foundation for our summer ahead, a summer of hope and a summer of healing, where COVID-19 will be in the background instead of front and center in our lives. Our progress on dose 1 immunizations is steady, and those dose 2s are rapidly increasing. But the virus is still with us, and we have seen in other communities around the world, in the UK, in Israel, in our neighboring territory in the Yukon, where it can still cause disease and illness and spread, and some people can get seriously ill. Vaccines are our best protection, and there is still potential of this virus to affect our communities. So to make this a summer we can all enjoy, I encourage everybody, make sure your children are immunized before the summer holidays get underway. Encourage and keep your family members near and far to do the same. And book your second appointment as soon as you are eligible. Our progress through this pandemic is the result of everyone working together, and we have done that in BC. Doing our part, supporting others to do theirs. I've said many times we're all in this same global storm, but we are not all in the same boat, and people in the North know this well. But we have done the right things, and we need to continue to do that, to make that extra push, to make sure that we're as best protected as we can, supporting each other to be immunized as we bridge to these brighter days of summer. Let's get our vaccines. Remember to continue to use our layers of protection as we have for the last number of months. And of course, let's always remember to be kind and to be calm and to stay safe.